Question 201. A 77-year-old male presents with a history of enuresis and change in behavior. Exam, waddling gait. What is the most likely diagnosis? Option A, subdural hemorrhage. Option B, brain tumor. Option C, Parkinson disease. Option D, normal pressure hydrocephalus. Option E, Alzheimer's disease. So our correct option here is option D, normal pressure hydrocephalus. So patient is 77-year-old male, and he has history of enuresis, that is uncontrolled urination, and change in behavior and waddling gait. So these three are signs of normal pressure hydrocephalus. So our correct option is option D, normal pressure hydrocephalus. Presence of enuresis, change in behavior and waddling gait. These are signs of normal pressure hydrocephalus. Question number 202. A child presents with low HB, low platelet and high WBC. What is the diagnosis? Option A, ALL. Option B, AML. Option C, CML. Option D, CLL. Option E, Hodgkin's. So the correct option here is ALL, or acute lymphoblastic leukemia. So it is present only in the children. So low HB, low platelets, and high WBC, they all indicate acute lymphoblastic leukemia. And acute lymphoblastic leukemia, or ALL, it is present, specifically present in the children. So the correct option is option A, ALL, or acute lymphoblastic leukemia. Question number 203. A 6-week child is brought in with vomiting, constipation and decreased serum potassium. What is the most likely diagnosis? Option A, pyloric stenosis. Option B, duodenal atresia. Option C, Hirschsprung disease. Option D, gastroenteritis. Option E, intussusception. So the correct option here is option A, pyloric stenosis. Pyloric stenosis, the main features of pyloric stenosis, it happens mostly in children from 2 to 6 weeks. So their characteristic features are vomiting, constipation and decreased potassium. So due to excessive vomiting, serum potassium level is decreased. So the correct option here is option A, pyloric stenosis. Question number 204. A diabetic patient develops renal impairment. What is given to delay progression? Option A, ACE inhibitor. Option B, diuretics. Option C, insulin. Option D, calcium channel blockers. Option A, steroids. Question number 204. A diabetic patient develops renal impairment. What is given to delay the progression? Option A, ACE inhibitors. Option B, diuretics. Option C, insulin. Option D, calcium channel blockers. Option E, steroids. So the correct option here is option A, ACE inhibitors. So ACE inhibitors are given in a diabetic patient to stop the renal impairment. So the correct option here is option A, ACE inhibitor. It is most effective drug in the diabetic patient to stop renal impairment. Question 205. A patient with renal disease. Which drug delays progression? Option A, ACE inhibitors. Option B, ARB. Option C, beta blocker. Option D, calcium channel blocker. Option E, steroids. So which option is correct? Correct option is option A, ACE inhibitors. So ACE inhibitors are most effective drug in this condition. Question number 206. A 23-year-old girl presents with perioral paresthesia and carpopedal spasm 20 minutes after a huge argument with her boyfriend. What is the next step for this patient? Option A, SSRI. Option B, diazepam. Option C, rebreathe into a paper bag. Option D, propranolol. Option E, alprazolam. So the correct option is option C, rebreathe into a paper bag. So the girl is 23 years old and presence of perioral paresthesia. Perioral paresthesia is some kind of sensations around the mouth, and carpopedal spasm. These are some sort of changes in the hands and foot. So the next step for this patient is option C, rebreathe into a paper bag. It is the correct option. Question number 207. A patient suddenly develops anxiety, palpitations, sweating, trembling, chest pain. What is the most likely diagnosis? Option A, panic disorder. Option B, general anxiety disorder or GAD. Option C, depression. Option D, schizophrenia. Option E, OCD. So the correct option here is option A, panic disorder. Presence of anxiety, palpitations, sweating, trembling and chest pain, these are all symptoms of panic disorders. So our correct option here is option A, panic disorder. Question 208. A 2-year-old child is very naughty. His teacher complains that he is easily distracted. His parents say he can't do a particular task for a long time. He sometimes hurts himself and breaks many things. This causes many troubles at home. What is the most likely diagnosis? Option A, ASD. Option B, dyslexia. Option C, ADHD. Option D, antisocial disorder. Option E, conduct disorder. So the correct option here is option C, ADHD, attention deficit disorder. So a 2-year-old child, he is very easily distracted. His parents say he can't do a particular task. This is very important point. He can't do a particular task for a long time. He sometimes hurt himself and breaks many things. This causes many troubles at home. So these all indicate the patient has attention deficit disorder or ADHD. So the correct option here is option C, ADHD. Question number 209. A child with diarrhea and vomiting. What is the investigation is required? Option A, blood urea electrolytes. Option B, blood sugar. So the correct option here is option A, blood urea electrolytes. So in child with diarrhea and vomiting, so investigation is option A, blood urea electrolytes. These other options, CBC, CXR, AXR, these are incorrect. So the correct option here is blood urea electrolytes. Question number 210. A child with diarrhea and vomiting. What is the best initial investigation? Option A, blood urea electrolytes. Option B, blood sugar. Option C, CBC. Option D, CXR. Option E, AXR. So the correct option here is option A, blood urea electrolytes. So because of diarrhea and vomiting, so the initial investigation is blood urea electrolytes. So option A is correct. Question number 211. A 72-year-old man fell while shopping and hurt his knees. His vitals are fine. He speaks in a low voice and is very slow to give answers. What is the most probable diagnosis? Option A, Parkinson's disease. Option B, depression. Option C, dementia. Option D, stroke. Option E, delirium. So the correct option here is option A, Parkinson's disease. So Parkinson's disease is basically present in the old age people. So his vitals are fine, but he speaks in very low voice and very slow to give answers. So due to memory loss. So the correct option here is option A, Parkinson's disease. Question number 212. A patient with tremor and slow speech. What is the diagnosis? Option A, Parkinson's disease. Option B, stroke. Option C, depression. Option D, dementia. Option E, delirium. So the correct option here is option A, Parkinson's disease. So the tremor, slow speech, so these are characteristic features of Parkinson's disease. So the most likely diagnosis is option A, Parkinson's disease. Question 213. A 49-year-old patient presents with right hypochondric pain. Investigations show a big gallstone. What is the most appropriate management? Option A, lab cholecystectomy. Option B, reassure. Option C, low-fat diet. Option D, ursodeoxycholic acid. Option E, emergency laparotomy. So the correct option here is option A, lab cholecystectomy. So presence of right hypochondric pain and investigations show a big gallstone. So in a 49-year-old patient, the most appropriate management is option A, lab cholecystectomy. Question 214. A patient presents with tremor. Which drug causes tremor? Option A, lithium. Option B, fluoxetine. Option C, imipramine. Option D, haloperidol. Option E, diazepam. So all these drugs can cause tremors except diazepam. Diazepam is used for treatment of tremors. So lithium can cause tremor, fluoxetine can cause tremor, imipramine can cause tremor, haloperidol can cause tremor. So any of these drugs, all these options are correct except diazepam, because diazepam is used for treatment of tremor. Question number 215. Which drug toxicity can cause coarse tremor? Option A, lithium. Option B, fluoxetine. Option C, imipramine. Option D, haloperidol. Option E, diazepam. So correct option here is option A, lithium. Lithium can cause coarse tremor. Coarse tremors are basically more severe tremors. These are because of lithium toxicity. So the correct option here is option A, lithium toxicity. Option A, lithium. Question number 216. A young woman complains of diarrhea, abdominal cramps and mouth ulcer. AXR shows distended transverse colon with globular appearance. What is the diagnosis? So the correct option here is Crohn's disease. It is the correct option. Ulcerative colitis. Option A, ulcerative colitis. Option B, Crohn's disease. Option C, IBS. Option D, colon cancer. Option E, infection. So the correct option here is option B, Crohn's disease. It is the correct option. Presence of diarrhea, abdominal cramps and mouth ulcers. These are characteristic features of Crohn's disease in a young woman. In a young woman, presence of diarrhea, abdominal cramps and mouth ulcers. These are characteristic features of Crohn's disease. AXR. What is AXR? AXR is abdominal X-ray. It shows distended transverse colon with globular appearance. So all these indicate Crohn's disease. So Crohn's disease is the correct option. Question number 217. A patient presents with mouth ulcers and diarrhea. What is the diagnosis? Option A, Crohn's disease. Option B, ulcerative colitis. Option C, IBS. Option D, colon cancer. Option E, infection. So the correct option here is option A, Crohn's disease. So presence of mouth ulcers and diarrhea, they indicate these are all present in the Crohn's disease. So the correct option is here is option A, Crohn's disease. It is the correct option. Question number 218. A 70-year-old man presents with balance difficulties, vomiting and nausea. Which of the following is the best investigation? Option A, MRI cerebellum. Option B, CT cerebellum. Option C, skull X-ray. Option D, lumbar puncture or LP. Option E, blood culture. So the correct option here is option A, MRI cerebellum. It is the correct option. Question number 219. Posterior fossa lesion best investigation. Option A, MRI. Option B, CT. Option C, X-ray. Option D, lumbar puncture. Option E, blood culture. So the best investigation for posterior fossa lesion is option A, MRI. It is the correct option. Question number 220. A footballer has been struck in the groin by a kick and it presents with severe pain and mild swelling in the scrotum. What is the most appropriate next step? Option A, ultrasound. Option B, Doppler. Option C, exploratory surgery. Option D, IV fluids. Option E, antibiotics. So a footballer is struck in the groin by a kick and a footballer presents with severe pain and mild swelling in the scrotum. So the appropriate next step is ultrasound. So option A, ultrasound, is correct option. Question 221. A patient develops mania after depression. What is diagnosis? Option A, mania. Option B, depression. Option C, bipolar affective disorder. Option D, personality disorder. Option E, dysthymia. So the correct option here is option C, bipolar affective disorder. It is correct option. So what is dysthymia? Dysthymia is also a form of depression. So it is also a mild form of depression. So our correct option here is option C, bipolar affective disorder. Question number 222. Depression followed by mania. What is diagnosis? Option A, mania. Option B, depression. Option C, bipolar disorder. Option D, personality disorder. Option E, dysthymia. So depression followed by mania. So the correct option is option C, bipolar disorder. It is the correct option. Depression followed by mania is also it is always bipolar disorder. So so our diagnosis here is option C, bipolar disorder. Question number 223. A 28-year-old female presents with 3 months history of diarrhea. She complains of abdominal pain. What is the diagnosis here? Option A, Crohn's disease. Option B, ulcerative colitis. Option C, IBS or inflammatory bowel syndrome. Option D, cancer. Option E, infection. So these symptoms show the correct option here is option A, Crohn's disease is correct option. So in 28-year-old female, presence of 3-month history of diarrhea and abdominal pain. So the most likely diagnosis here is Crohn's disease. Question number 224. Child with barking cough and fever. What is treatment? Option A, corticosteroids. Option B, antibiotics. Option C, oxygen. Option D, IV antibiotics. Option E, intubation. So the child presents with barking cough and fevers, and so the correct treatment option here is option A, corticosteroid. It is the correct option. Question 225. Hyperkalemia emergency management. Option A, IV calcium gluconate. Option B, insulin. Option C, glucose. Option D, dialysis. Option E, sodium bicarbonate. So the emergency management of hyperkalemia is IV calcium gluconate. So the option A, IV calcium gluconate, is the correct option. Question number 226. Person with impulsive behavior and unstable relationship. What is diagnosis? Option A, borderline personality disorder. Option B, depression. Option C, schizophrenia. Option D, bipolar disorder. Option E, anxiety disorder. So the correct option here is option A, borderline personality disorder. So impulsive behavior and unstable relationship, all these happen in the borderline personality disorder. So correct option here is option A, borderline personality disorder. Question number 227. Patient with impulsive relationships. What is diagnosis? Option A, borderline personality disorder. Option B, depression. Option C, schizophrenia. Option D, bipolar disorder. Option E, anxiety disorder. So patient with impulsive relationships, the correct option here is option A, borderline personality disorder. It is the correct option here. Question 228. Impulsive emotional behavior disorder. Impulsive emotional behavior disorder is option A, borderline personality disorder, option B, depression, option C, schizophrenia, option D, bipolar disorder, option E, anxiety disorder. So the correct option here is option A, borderline personality disorder. So impulsive emotional behavior is borderline personality disorder. Question number 229. Woman brought to hospital with low temperature and tremor. What is cause? Option A, hypothyroidism, option B, hyperthyroidism, option C, infection, option D, drug toxicity, option E, alcohol withdrawal. So woman with low temperature and tremor. So correct option is option A, hypothyroidism. That is the correct option. Question 230. Anaphylaxis treatment is option A, bronchodilators. Anaphylaxis treatment is option A, bronchodilators, option C, steroids, option D, epinephrine IM, option E, nebulized epinephrine. So correct option is option D, epinephrine IM. It is the correct option. (231) Anaphylaxis management is option A, oxygen, option B, steroids, option C, epinephrine IM, option D, antihistamine, option E, nebulization. So anaphylaxis management is option C, epinephrine IM. It is the correct option. Question 232. A 63-year-old female is noted to have left pupil irresponsive to light and is dilated. What is diagnosis? Option A, pontine hemorrhage, option B, subdural hemorrhage, option C, cerebral hemorrhage, option D, cranial nerve palsy, option E, stroke. So the correct option is option A, pontine hemorrhage. It is the correct option. Pontine hemorrhage is basically hemorrhage at the pons region of the brain where hemorrhage happen and the pons. So that is option A. Patient depressed now but had hypomania before. What is diagnosis? Option A, anorexia nervosa, option B, bipolar disorder, option C, binge eating disorder, option D, hyperthyroidism, option E, schizophrenia. So the correct option is option B, bipolar disorder. It is correct option. Option B is the correct option here. 234. Patient with personality disorder with impulsive criminal behavior. What is diagnosis? Option A, narcissistic, option B, borderline, option C, avoidant, option D, histrionic, option E, antisocial. So the correct option is option E, antisocial. That is correct option. Question 235. Criminal irresponsible behavior disorder. Option A, narcissistic, option B, borderline, option C, avoidant, option D, histrionic, option E, antisocial. So the correct option here is option E, antisocial. It is the correct option. A 60-year-old man has pathological rib fracture. What is diagnosis? Option A, osteogenesis imperfecta, option B, hypopituitarism, option C, ventricular septal defect, option D, achondrogenesis, option E, dwarfism. So pathological rib fracture is in the osteogenesis imperfecta. So the option A, osteogenesis imperfecta, is the correct option. Bone fragility disorder diagnosis. Option A, osteogenesis imperfecta, option B, hypopituitarism, option C, ventricular septal defect, option D, achondrogenesis, option E, dwarfism. So the bone fragility disorder is its option A, osteogenesis imperfecta. It is the correct option. A 5-month child developmental status. Option A, normal, option B, delayed, option C, advanced, option D, autism, option E, ADHD. So in a 5-month-old child, developmental status is normal. So option A is correct option. child milestone question. Option A normal, option B delayed, option C advanced, option D autism, option E ADHD. So the child milestone question is normal, so option A is correct. Young female with superficial lacerations fears abandonment. What is diagnosis? Option A acute psychosis, option B severe depression, option C OCD, option D bipolar, option E borderline personality disorder. So the correct option here is option E borderline personality disorder. Self-harm, unstable relationships disorder. Option A acute psychosis, option B depression, option C OCD, option D bipolar, option E borderline personality disorder. So the correct option here is borderline personality disorder. Self-harm, unstable relationships, these are signs in the borderline personality disorder. So option E is correct. Man thinks traffic light signal means mother calling him. What is diagnosis? Option A schizophrenia, option B OCD, option C depression, option D anxiety, option E bipolar. So the correct option here is option A schizophrenia. It is the correct option. Delusion disorder diagnosis. So what is diagnosis of delusion disorder? Option A schizophrenia, option B obsessive compulsive disorder, option C depression, option D anxiety, option E bipolar. So the delusion disorder diagnosis is schizophrenia, so it is correct option A. CPR compression in infants. So which option is correct? Option A index and middle finger compression, option B one hand compression, option C two hand compression, option D 30:2 compression, option E 15:2 compression. So the correct option here is option A index and middle finger compression. Option A, it is the correct option. Child abuse suspected. Next step. Which option is correct? Option A inform authorities, option B ignore, option C treat injury, option D ask parents, option A discharge. So if child abuse is suspected, so first step is to inform authorities. So correct option here is option A inform authorities. It is the correct option. Lithium toxicity is caused by which drug? Option A verapamil, option B amiodarone, option C ranitidine, option D lithium, option E thiazide. So the correct option here is option E thiazide. So lithium toxicity can be caused by thiazide drug. So correct option here is option E. Lithium interaction drug. Option A verapamil, option B amiodarone, option C ranitidine, option D lithium, option E thiazide. So lithium interaction drug is option E thiazide. So thiazide is correct option. So lithium and thiazide, these are interactive drugs. So their interaction, lithium interaction drug is thiazide. A 74-year-old man presents with weakness in his arm and leg. What is diagnosis? Option A stroke, option B tumor, option C Parkinson, option D MS, option E infection. So a weakness in arm and leg is diagnosis of strokes. So correct option here is option A. Option A is correct option. OCD treatment best. OCD best treatment. Option A CBT, option B SSRI, option C ECT, option D antipsychotics, option E desensitization. So obsessive compulsive disorder best treatment is CBT and SSRI. These both options are correct. So for obsessive compulsive therapy, cognitive behavioral therapy or CBT is main treatment. So option A or B, these are combined options. These two are correct. A 61-year-old man underwent ileal resection. He complains of fatigue, headache, and heart racing. Labs show MCV 108FL, HP 8.9, and what is diagnosis? So presence of fatigue, headache, heart racing. These also our diagnosis is option B, vitamin B12 deficiency. It is the correct diagnosis. So these option: folate deficiency, hemolytic anemia, aplastic anemia. These all are incorrect. So correct option here is option B, vitamin B12 deficiency.